The healthcare industry is a very rapidly growing industry, but it's also a very competitive industry. So whether you're starting a career in healthcare, whether you are already working in healthcare and looking to move up into the management ranks, whether you're already a manager but looking to move up into the executive positions, the Widener MBA will provide you skills that are very valued by employers and are going to enable you to not only do well in your job, but also going to enable you to advance your career. The Widener MBA is going to make a big difference in your career aspirations.
Not only have we seen changes within our program, but we've certainly seen changes in the healthcare industry.
You should definitely go for a healthcare MBA if you're in the healthcare field. It's turning out that in the future, it's most likely looked at as the business of healthcare.
We started in 1977 when the Health and Medical Services Administration program was approved by the Board of Trustees of what was then known as Widener College. Since then we've become Widener University. In 1982 we received our first national accreditation from AKISA. We're only one of 3 programs in the Greater Delaware Valley area to have accreditation from CAMI, as well as accreditation, as well as being located in the accredited business school.
I chose Widener because I had the healthcare management portion of the MBA program, as well as being an accredited program.
I chose Widener because there's only a few schools that are accredited for their business school for the healthcare management program in the Philadelphia area, and Widener is one of them.
We target full-time healthcare professionals, people who are working full-time in the industry, going to school part-time. And I think that's part of what makes it a valuable experience.
Quality, like in healthcare, quality in academia is judged by accreditation. And most programs are either accredited by AACSB, which is a business accreditation, or by CAMI, which is a healthcare accreditation. Now, Widener is one of only 3 programs in this entire Delaware Valley region that has both accreditations. It's hard for people to come back to school when they have full work lives and family responsibilities.
I definitely was working when I got my degree, and it's a balancing act. You have to make sure that you're very organized and that you treat work and school equally. It is definitely doable, and Widener makes it very easy because it's geared towards working professionals.
So one of the unique features of our program is that it's very flexible. We have full-time, part-time, 1-year, 4-year programs, weekend classes, online classes that make it very easy for people who have family and work responsibilities to come back to school. And so if you talk to our alumni, if you talk to our students, you'll get a good sense of how students who are exactly in those positions with those type of responsibilities are find it very easy to come back and get a degree from us. So we are very flexible.
In making the decision between a 1-year or a 2-year program, you really need to consider the class load and how much you can take on in your lifestyle. If you are working full-time and you're trying to compress a 2-year program into one, it might be very difficult. However, if you can manage it, getting out there and using your new degree would be very worthwhile.
I started at Widener and did my schooling all at night. When I finished my Widener degree, I got my fellowship experience at Graduate Hospital, and from that point forward, my career just took off. So it was really Widener that started my whole healthcare career.
The program works really well in my schedule. I like the fact that the master's classes start at about 6:30, which is really good because I live in Delaware.
The MBA works within my schedule. Yes, it does. I work during the day at the Small Business Development Center, and then I take the night classes.
It's important that the classes are focused with healthcare content, so when you take an economics class, it's focused on healthcare economics, just not general economics. When you do a project in a cost accounting class, that project uses real-life healthcare examples so that when you go out trying to apply what you learned in a general graduate program and apply it to the content in a healthcare setting, you really have already that process during your education.
We also have executives coming into our classrooms, you know, co-teaching our courses along with our faculty, so that allows us to bring cutting-edge knowledge and technology and those kinds of things into the classroom.
The most important thing is the success of our students, and that comes from what we teach in the classroom.
The teachers are great. They want to help you in every way possible.
You really get to interact with the professors a lot, and every professor will know you by name, definitely.
I think Widener is doing a really good job in keeping you one step ahead of where things are going.
It's not just about whether your focus is in information technology or finance or clinical work. It really is understanding the business of healthcare. So in healthcare-specific MBA, I think, is incredibly important, much more so than it had been in the past. The economic climate in healthcare has changed quite a bit. The landscape going forward looks like it's going to continue to change.
Learning process, and it's all about the choices you make. So you should choose wisely. Choose Widener.